Hello, welcome to Midwife Dave. Today I'm going to talk to you about Caesarean section. We're going to be focusing on elective section, not the emergency section, which is the one that happens when something's not gone quite right in the room and there's a problem with mum or baby. Okay, elective section. So you've booked your section. It can be for a variety of reasons. Maybe you just think that's what you want, that's the best thing to do. It could be because baby's breech and they don't want to do a vaginal delivery, nor do you. It could be because you have multiple babies, twins, triplets, and they're not in a great position to deliver vaginally. Could be because you had an emergency section before and they've recommended you have one this time. Could be for a variety of problems. Whatever it is, the basic process is the same, okay? Don't be worried. It's really, really straightforward. Generally speaking, it's not anything to worry about. Obviously, with anything, with surgery, there's a minor risk of something happening, and they'll talk you through all of that when they do your consent form, which the consultant should have done at your consultant visit. Let's hope he did, or she did. So you'll visit the consultant, you get the date ready, okay, you'll be talked through everything, hopefully. You'll then have an appointment with the anaesthetist and they'll talk you through the types of anaesthetic. Generally they try spinal, epidural or a combination. If they can't do either of those for some reason, then you'll have a general anaesthetic. When there is a general anaesthetic, dads aren't allowed to stay in the room, unfortunately, in most units. Okay, the day's arrived, you've been given your medication to take at midnight the night before when you stop eating, because you will be starved. And again, probably around about 6 o'clock in the morning, you take your second lot of medication. This is anti-acid for two reasons. One, you're going to be starved, so you're not going to be eating. So we don't want you making lots of acid. And two, in case you have a general anaesthetic, we don't want you vomiting whilst you're under. That's never a good day. Okay. So you're going to ring the unit in the morning, check out what time you're going to come in. Some units only have one theatre, so if there's emergencies, you may be delayed on coming in. That's quite tough if you can't eat. Some units have an enhanced recovery programme, so ask them about this. And that's when you're allowed things like glucose drinks, Lucozade, etc., to keep your sugar levels up whilst you're waiting to go in. And they also try and get you recovered much quicker and get you home quicker. Okay, so let's say you've made the phone call, it's fine for you to go in, you're coming in to see us. When you arrive, you'll be greeted by your midwife and we'll take you to a room. We will do all your observations, blood pressure, pulse, temperature. We'll get you changed into a very lovely hospital gown. Nothing at all underneath it, please, open at the back. So bring a dressing gown or ask for 2 gowns so you can use one as a dressing gown. We'll then give you some very attractive stockings. These are really tight, they go on your legs. These are called TEDs or anti-embolic stockings, same as flight socks, so keep them afterwards, that's a handy hint. Give them a wash in the washing machine and you can use them when you're flying. Does the same thing, it's to stop you getting a blood clot. All right, dads, we're going to get you changed into one of these lovely outfits. So you'll get some scrubs, okay? And then what we do is wait to be called to the theatre. Now, we will also go through a checklist with you and ask you all sorts of questions, and this is for theatre purposes, so don't be surprised. We'll be asking you questions about if it's your own leg, are you actually pregnant, are those your eyeballs, etc. Okay, have you got any piercings? Make sure your jewellery is out. No secret piercings, thank you. Get those out or get them taped, but do let us know if you can't do anything about them and they're still in situ. Okay. So then you're ready and you're prepared for theatre. What will happen is we'll take mum in first of all and get the anaesthetic in place, okay? So we'll sit you on the edge of the couch. The anaesthetist will be doing the spinal epidural, hopefully, and then we'll lie you back on the couch, and the midwife generally will put a catheter into your bladder. So we put a tube up your wee hole, basically, into your bladder, and because you won't be able to wee, because you won't feel it, okay? And that will stay in for the next 12 to 24 hours. Okay. We'll then get dad in, we'll put a screen up sort of from your chest level up so you can't see anything that's going on, so don't worry. Top tip, if you're squeamish, and dads if you're squeamish, okay, do not look up into the light because theatre lights will reflect everything that's going on down there and you'll see everything. So if you are squeamish, don't look up, all right. So we will start. The surgeon very often will touch you with something sharp and ask you if you can feel that. You should just feel pressure, like somebody pressing you. You shouldn't feel any sharp pain at all. If you do, let us know immediately. Shout as loud as you can. Let us know. We'll stop and adjust your anaesthetic. All right. Okay. The whole section itself is really quick. 10 to 20 minutes, and generally we have a baby. Okay. Although it's really quick, don't forget, it's major abdominal surgery, all right? So it's really important to remember that, especially for afterwards. So the baby is generally given to the midwife. and we will show your baby either over the top of the screen, round the side, okay? Sometimes they drop the screen down. We'll take baby to what's called a resuscitator. It's like a cot with lots of bits and pieces on, and that's where we take baby if it needs any extra help, any oxygen or anything. But it's also great because it's nice and warm. Generally, we use it just because it's nice and warm and comfy to give baby a little rub before we wrap them up and bring them over to you. You can do skin to skin. You can pop baby down inside your gown, okay? We can help you with that. Or we can keep baby nice and wrapped up and you can both have a little cuddle. Ask one of the people, maybe the theatre people or your midwife to take a picture of the three of you. I like to do that for my couples. That's just something I like to do. But ask your midwife because that's a really magical moment. Okay, once you're put back together and stitched up, we'll take you back into what's called recovery. And that's where you'll be monitored. So your blood pressure and everything will be checked every 5 minutes. We'll be checking your bleeding, making sure your tummy's okay, making sure nothing's coming out of your wound. We'll help you with breastfeeding. Some units will let you eat and drink as soon as you feel hungry and you're in recovery. Some units are a bit stricter about that, so make sure you ask about that, okay. Then we take you onto the ward, where you will be recovered and looked after. Now, what we will want to do in most places now is get you up as soon as we possibly can. I know that sounds really scary, okay. Top tip again, stay on top of your pain relief. Don't think, oh, I feel great. When we come and offer it to you, take it. Because what will happen is the anaesthetic, the spinal, epidural, whatever you've had will cover you, so you won't feel any pain initially and you'll think, I feel all right. But that will start to wear off. You don't want to be at a point where you're feeling the pain and now you've got to rely on taking enough paracetamol, ibuprofen, whatever it is, to make the pain go away. We want to make sure you stay on top of it and you don't have that breakthrough pain. So remember, if you're offered pain relief, take it. Okay. We'll then come and tell you that it's time to get you up and get you in the shower. You'll be really anxious. It will hurt the first time you get up for several reasons. One, you're really stiff because you've been lying down for quite a long time. Two, you've probably not eaten very much at all and you've been awake because you might have been awake the night before worrying, okay? And three, because you've just had an operation. So, what we'll do, first of all, generally we take the catheter out. That just feels a bit weird. It doesn't hurt, but it is a bit of an unusual sensation. We'll then get you to sit up in the bed. Do everything really slowly, okay? We'll then get you to move to the edge of the bed until your feet touch the floor. And really do it slow. Don't feel rushed, okay? We'll then get you to sit there for a few seconds and then we'll get you to stand up. Now, you might feel initially a little bit wobbly, but you shouldn't feel sort of overly dizzy or anything. Top tip, hold onto your bump. Get your hands around your tummy, okay? Don't be frightened of touching the wound and apply pressure, sort of in and up a little bit, okay? Support it. What you're doing is preventing gravity from dragging it down because that's when it really hurts. And then you're just going to take little steps, all right, to the bathroom. I guarantee you, once you've had your shower, unless you've got any major complications, you will feel much, much better. When you come back, you'll be quite exhausted because that's quite hard work, okay? But really important, again, is keep mobile. Don't go crazy. We don't want you sprinting around the ward and collapsing because you're overdoing it. But it's really important that you don't spend the whole time lying down in the bed, okay? Because you'll stiffen up and then it makes getting up as if it's that first time all over again. So little movements, sit in the chair for a little bit, you know, and then what we'll do also is we'll give you pots to wee in once you've had your shower because we need to make sure that your bladder's working. And we call it a TWOC, okay? You might hear that term. Don't worry. All that means is that we need to measure at least your first 3 wees to make sure that your bladder's woken up from the anaesthetic and it's working properly. Another top tip, in the next couple of days you will want to have a poo. Don't be frightened. I promise you won't unravel. Nothing terrible will happen. Whatever you do, do not get so frightened that you don't go. Don't make yourself constipated because obviously then that is going to be uncomfortable. All right, and keep an eye on your diet. Drink lots and lots of water. I know I'm always banging on about lots of water, but really important. And also do your pelvic floor exercises. You may not feel anything initially, but it's not going to do you any harm. Check out the pelvic floor video that we've got back a few videos ago now. Okay, that basically is it. Now, the other thing to remember is when you go home and you feel great, don't overdo it. It's really important. Remember, it is major surgery. Although we don't want you being a dying swan just lying on the sofa all day for 24 hours a day, we don't also want you back in the gym in the week. Okay, follow the guidelines you're given, be sensible, and you'll be absolutely fine. Another thing to note, if you're breastfeeding, sometimes it can be a little bit of a struggle at first when you're breastfeeding post-section, because the signals to the brain to start the lactation process are slow getting round because you haven't delivered vaginally. So your body has got to be aware that the baby's no longer on board. Okay, so the first 24 hours can be a little bit tricksy. Persevere, all right, and don't lose heart if that's what you really want to do. Okay, so that's your section, all right. Any questions, any concerns, anything else that's worrying you about having a section, then feel free to message me on here. And don't forget to subscribe and find out what else is going on.